Vuno, President of SALGA, Councillor Beki Stofile, SANAC CEO, Dr. Tembisile Kulu, and this year's World AIDS Day, it is also an appropriate time to reflect on the progress we have made and recommit ourselves to doing whatever it takes to achieve our collective vision of an AIDS-free world, as well as to stand in solidarity with the millions of people living with HIV in our country and around the world. The theme of this year's commemoration is Equal Rights, Equal Care, which calls for equitable, dignified, and equal access to health care for all South Africans, irrespective of their economic status, gender, ethnicity, or sexual orientation. In addition, the theme emphasizes the intrinsic dignity and worth of every individual who is impacted by HIV/AIDS. It demands a decisive halt to discrimination, to stigma, and injustices that persistently obstruct our advancement in combating this pandemic. It is important that everyone living with HIV and AIDS has access to excellent medical care, treatment, and support programs. We are determined to ensure the protection of everyone's rights through access to the same level of care in line with the principle of the newly enacted national insurance model. As a United Nations member state, we are committed to improving the quality of life of all citizens. Over the past years, South Africa has made significant strides in addressing the HIV/AIDS epidemic. There has been many scientific advances in treatment and antiretroviral therapy, which have allowed people to live long and productive lives. Scientists are optimistic that improved treatment options can enhance prevention and they are actively working on a cure and vaccine. However, our country remains the epicenter of HIV and is among those with the highest TB burden. There are nearly 8 million people living with HIV and TB, and TB remains the leading cause of death, claiming around 56,000 lives every year. We must always be cognizant of the fact that HIV is not only a public health crisis, but also a developmental challenge and a human rights matter. Our approaches must be comprehensive, targeted, inclusive, and geo-specific. Through the National Strategic Plan, the NSP, which also calls for a whole-of-society approach, it recommends the introduction of new injectables for HIV prevention and treatment in the country's HIV program. Program directors, South Africa is among countries in sub-Saharan Africa that has made significant contribution to the global body of knowledge on HIV prevention, as these HIV injectable medicines were tested in this country. However, they are now widely accessible in the global north and remain inaccessible in the global south. SANAC will prioritize the establishment of a multi-sectoral working group in order to expand access and the sustainability of injectable antiretroviral introduction in the country's HIV program. This working group will collaborate with the Department of Science, Technology, and Innovation, also trade, industry, and competition, health, as well as the private sector and civil society in order to address the barriers that impede fast access and availability of these medicines to the South African population. We must prioritize community-led responses and interventions to guarantee that no one is left behind. Program directors, a community-centered approach to HIV is important for several reasons, including reducing stigma. Since community-driven programs can help reduce HIV-related stigma and discrimination. Community centers approaches can improve health literacy and empower people to access health care. This in turn feeds into demand creation for prevention services and promotes retention in HIV care. We are aware of the challenges in our health system and are actively working as government to address these. The National Health Insurance, NHI, is a step towards achieving universal health coverage and alleviating the uneven distribution of resources and congestion in our public health facilities. When we work with communities, we learn what shapes their culture, knowledge, attitudes, and beliefs. Understanding these factors enables us to design and implement interventions that are tailored and targeted at specific communities and demographics, such as the youth. Compatriots, HIV is prevalent amongst young people, especially adolescent girls and young women between the ages of 15 and 24, with a weekly record of 1,300 new cases. The infection rate amongst boys of the same age, however, is almost 3 times less, meaning girls are more vulnerable to HIV infection. A variety of factors, including the biological makeup of their bodies and their involvement in age-disparate relationship, contributes to this phenomenon. Nevertheless, we need more interventions designed for adolescent girls and young women. As SANAC, we are particularly pleased to note that all provinces have integrated the Zikhala Kanjani Youth HIV Prevention Strategy in their provincial implementation plans. The strategy proposes specific interventions for all youth in their diversity to ensure that we are raising a generation that will conquer HIV. Program directors, we need messages that resonate with young people. We can't use the one-size-fits-all approach because young people need to be understood, they need to be listened to, they need to have their space and their own lingo. We cannot change their behavior until we reach them with our messages. We must allow them to be young people, but surely to be guided. Instead of pushing them away, let's bring them closer, making it easier for them to seek medical care and take medication whenever it's necessary. This is where technology emerges not just as a tool, but as a potential game changer. By leveraging the power of digital platforms, we can reach vulnerable populations, personalize interventions, and ultimately rewrite the history of HIV prevention in this country. This is because technology provides us an opportunity to engage with youth wherever they are, on their phones in particular. It enables us to overcome traditional barriers and convey critical information in an entertaining and accessible manner. I am encouraged by campaigns such as Forever Wena, a movement that aims to empower youth to take charge of their sexual health. It encourages open, factual, and informative discussions about healthy sexual behavior and choices through its WhatsApp chatbot, a digital campaign that is available 24/7, that offers a confidential space for people to access vital information, but also support. The Department of Health, in collaboration with stakeholders, including PEFA, has released the new BeWise app, a progressive web app for youth-friendly health services and information. A progressive web app for youth-friendly services. This BeWise app is an interactive digital platform that aims to enhance the accessibility of health services for adolescents and young adults, such as HIV prevention, mental health, family planning, and contraceptive youth, empowering them to make informed decisions about their sexual and reproductive health. Compatriots, we also have challenges with managing HIV in children and putting them on medication. Hence, we launched the South African chapter of the Global Alliance to End AIDS in Children by 2030 during last year's World AIDS Day commemoration. On that occasion, Mrs. Mashatile was inducted as a patron of the Global Alliance initiative in South Africa. And since assuming her duties, the patron has actively engaged on various platforms, raising awareness about the challenges faced by children and adolescents affected by HIV epidemic. Her efforts exemplifies the dedication required to address these issues effectively. The elimination of vertical transmission of HIV in children remains a cornerstone of our efforts to achieve the goals of both the National Development Plan and the United Nations Sustainable Development Goals as we get closer to the Agenda 2030. Yesterday, the Eastern Cape province launched its Global Alliance Plan, as the Premier indicated, and we congratulate them for this achievement. Siyabulela, dear. This makes the Eastern Cape the first province in the country to develop and officially launch its own action plan for the Global Alliance. We encourage all other provinces. Thank you so much. We encourage all other provinces to also launch their plans for us in order to succeed to defeat this epidemic. We are pleased that several partners, including the private sector and development agencies, are rallying behind this noble cause, sharing their expertise and also providing required resources. Their collaboration reinforces our shared determination to fulfill the promise of eliminating HIV amongst children and adolescents by 2030. Together, we are building a future free from HIV for the most vulnerable members of our society. As different countries work towards the goal of ending AIDS as a public health threat by 2030, ensuring long-term sustainability of the HIV response, rather ensuring that sustainability, the long-term sustainability response is paramount. Achieving this goal requires transformative action in policy, but also programs and systems. It also demands a clear vision, early planning, and strategic approaches to address financial responsibilities to ensure that both government and our partners are equipped to remain and maintain a robust HIV response. We have already seen how the reduced fiscal allocations by government and donors can have a negative impact on HIV and TB programs, especially during the COVID-19 pandemic. I know that other social partners have been pleading with me and Minister Motsoaledi that they would like that government should at least assist to increase resources for SANAC. So we are working on that to assist SANAC so that SANAC can become effective. Program directors, the fight against HIV and AIDS required all of us to act together. We have made satisfactory progress, but like in any long march, we have not reached our golden goal. The last miles have become tougher. So we need to unite. We need to work together as we go through this last miles. We are also happy that the Department of Health, working together with SANAC and our development partners, agreed to the big, fast and quick results of tracing these 1.1 million people living with HIV and linking them to treatment between today and December 2025. It's a big task, but I think it's important that we must do it. As the ministers and the Premier also said, that particularly the second 95, we must make sure that that second 95 is something we pay attention to, for people to take treatment. Linking this 1.1 million people to treatment will enable us to reach the UNAIDS target of 95, 95, 95 as we have planned. Let us all play part and contribute to making this initiative a success. Program Director, while significant strides have been made in ensuring that 95% of people living with HIV/AIDS know their status, the same cannot be said with respect to ensuring that 95% of people who know their status are on treatment, and that 95% of people on treatment are virally suppressed. So that's why we need to pay a lot of attention on the second 95, and as government, we are determined to do exactly that, working with all partners. Program directors, as of June 2024, only 79 of our people who knew their status were on treatment. The minister has already alluded to this. And only 93% of people on treatment were virally suppressed. And the minister indicated that this target relies on the second one. If we can't get it right on the second one, we can't get it right on the third one. Improvement across the 95, 95, 95 indicators was more pronounced in males compared to females. This point has been made strongly by the minister. And as a country, we need to further increase HIV screening, diagnosis, and treatment initiation while maintaining treatment and adherence to treatment to keep the viral suppression rates very high. We therefore urge all government departments to incorporate HIV, AIDS, and TB in their workplace health and wellness programs. In the same breath, we call upon political parties, trade unions, students' organizations, and other formations to encourage their members and supporters to know their HIV status, and those who know their status to seek treatment and to remain on treatment. The transport industry in particular also has an important role to play in conveying these messages on the importance of health screening to the multitudes of people who use public transport on a daily basis. Our traditional leaders need to continue to use platforms at their disposal, such as community meetings, izimbizo, traditional initiation schools, funerals, and such events to encourage their subjects to test for HIV, for TB, to know their status, and most importantly, to stay on treatment if they have tested positive for HIV and TB. We will continue to rely on religious leaders as well to mobilize all men and women who worship, especially those who are HIV positive and have stopped treatment, to please return to treatment. Now, Minister Mtswaledi says men don't go to church, so I don't know how religious leaders can help us with this one. But siyacela bafundisi zamani toch laba bakhona, let them get the message, those who come to church. Program directors similarly will encourage sporting bodies, their affiliates, clubs, and individual players to also contribute in this way by spreading the message to their members and their followers. I would like to urge all premiers of our provinces to make use of the provincial councils on AIDS to mobilize these sectors and others that are active in their provinces to help us find the 1.1 million people. All employers and employment organizations must also come to the party, the business people. This is a genuine battle, and if we fail to combat HIV and AIDS, it will ultimately lead to our downfall as a nation. Program directors, this past Monday, we launched the 16 days of activism for no violence against women and children in the Northwest Province. The dynamics within relationships and households identify gender-based violence as one of the social drivers of HIV. Similar to HIV, the complexity and multifaceted nature of gender-based violence and femicide contribute to their continued status as a nation in crisis. Addressing the GBV&F in South Africa requires a multi-sectoral and multi-faceted approach that includes education, legal reform, community engagement, and also support to victims. It also requires the economic emancipation of girls and women. We must protect the rights of all vulnerable groups, including the LGBTIQ community. Hate crimes must have no place in our society. Equal rights means protecting everyone and everywhere. The various activities organized by SANAC's main sector to mobilize men and boys to march against gender-based violence, femicide, and other social ills profoundly encouraged me. These activities are a build-up to the National Men's Parliament, which will take place on the 6th and the 7th this month in Parliament in Cape Town, where all formations working with men will provide provincial updates on the work that is being done in their communities since the last sitting in 2022. Program directors, as I conclude, SANAC Men's Sector is leading the National Men's Health Campaign known as Better Men for Tomorrow, today. Better Men for Tomorrow, today. This campaign calls upon all adolescent males and adult men to seek health services and learn about their HIV status and general well-being. I'm very happy that the men are standing up. Siyabulela botata, you are standing up now, we can see. Program Director, this campaign will bring health services to places where men congregate, most such as sporting events and traditional gatherings. And of course, I'm sure all these places that the minister was talking about, that we can find men there, we will go to those places. This campaign, Program Director, seeks, amongst others, to establish a coherent network of change that seek to advance men's health across the whole of South Africa. It also aims to reach 1 million men with a holistic advocacy, communication, and social mobilization. Program directors, working together, we can end AIDS by the year 2030. Siyabule. Thank you very much.
Amagwini mabandla ndinika khanjana. Luswazi madoda lumankhina la kulo nomathokazi. Lizube linakazi lenkomo zakwamalangana. Phuthumani ngcawa nikhumisa inqawa lungisana uhlala ithani ngwadalala nizole. Amankabane ayakhahlela kwingcacholo